basically where I grew up at, over East Baltimore, this area not far from John Hopkins, man. It's been wicked, man. It's like I wouldn't want to raise a family here.
So let's talk about the opioid crisis here in Baltimore. Do you see it as a crisis? Is it widespread? Is it affecting a lot of people?
Yes, it's widespread and it's affecting a lot of people. Black, white, whatever you is, Puerto Rican, Hispanic, it's affecting everyone and it's worldwide. And it's a war on it, man. We need to treat it as a war, man. It's crushing, man. Like everybody want Percocets, man, you know. But it's a war on that, man. I think we should attack it like a war, you know.
Of course. Now you're saying that would you say that the streets are filled with opioids? Would you say it's very easy that I could walk 15 feet away, 20 feet away and find a prescription or find heroin or find anything? You think it's easy to get that?
Absolutely. Coming up over here, yep, you could take 2 steps, man. Somebody selling something, man. Weed, perks, coke, heroin, you know. That's the reality of it, man. There's no mystery. Everybody knows.
So what's very interesting, what we're saying here, is we're saying that you can basically find any drug under the sun feet away, but you can't find a job here, or you can't find a nice piece of real estate.
Opiate use in Baltimore City is a significant public health crisis. Some of the associated problems include incarceration, needle-borne diseases, high mortality rate, and poverty. This has had a devastating impact on the city, with 2 of the most abused drugs being heroin and fentanyl. The CDC has reported that Baltimore City has an overdose rate of 85.2 per 100,000 citizens. The current tactics that have been used to combat opioid addiction in the city have not been successful at reducing this overdose rate. During the civil rights era, heroin use in Baltimore increased. This was caused by a combination of changes, including shifting dynamics in the supply chain, with Baltimore being a major port city, and then a combination of hope and despair during this time. Although heroin had traditionally been the opiate of choice in Baltimore City, recently fentanyl has overtaken heroin, and from 2016 through 2018, heroin overdose deaths decreased by 38%. Fentanyl is produced synthetically so that it can be manufactured much more quickly than heroin, which relies on the growth of poppies. The current approach to treating opiate addiction in Baltimore is primarily driven through the use of brick and mortar treatment centers throughout the city. The downside of this approach is that if someone who is in need of treatment is unable to access one of these centers, then they are unable to receive treatment. Stakeholders for the opioid epidemic in Baltimore City include those who are abusing these substances, community members, emergency responders, medical professionals, and taxpayers. All of these individuals are negatively impacted by this crisis. Many opioid users in Baltimore do not want to be hospitalized and are not able to afford paying for treatment. Also, as was seen in The Wire, opioid users often have strained relationships with the police force after the long war on drugs that has occurred in the United States. What opioid users do need is assistance and relief from their withdrawal symptoms, and they also at times need quick response for life-threatening emergencies. From a gap analysis standpoint, there are significant opportunities for improvement with regard to the opioid epidemic in Baltimore. There currently is a significant focus on short-term reactive solutions, whereas a longer-term approach would likely lead to better health outcomes. From 2011 through 2017, the overdose rate almost increased fourfold from 22.7 to 85.2 per 100,000. And a lot of this was driven by an increase in the use of fentanyl. There are very few treatment options in the 21217 zip code for medication-assisted therapy options for people dealing with opiate use disorder. Prior initiatives have included trying to reach out to those with opiate use disorder outside of a physical building. This included a somewhat successful van initiative that has been limited overall by funding, and that's where Zacks PACS is looking to further this outreach, which vastly reduces the stigma around addiction relief. Unlike traditional clinics, the mobile van provides convenience, privacy, and more open access to medical care. There are multiple advantages to using a van for outreach rather than having a brick-and-mortar treatment facility. Firstly, being able to engage those with OUD outside of traditional brick-and-mortar models provides an opportunity to improve outcomes. A vehicle also provides a level of mobility that simply isn't available with traditional models. The first metric that will be used to evaluate the success of the program is a reduction in the number of overdoses in the 21217 zip code over a 3-month period. The objective of this program is to provide individuals who are addicted to opioids medication to reduce their urge to use fentanyl or heroin or other dangerous opiates. The logic is by reducing the number of users, the rate of overdoses should decrease significantly. Zacks PACS will be a nonprofit organization. For this business, a mobile medical vehicle will be used in the 21217 area, and it will be staffed with medical professionals who will be able to administer Sublocade and Suboxone. This project will require government funding for initial startup to assist with equipment, staffing, and pharmaceuticals. However, further revenue will be received through insurance reimbursements. We estimate that the initial cost will be $75,000 for a mobile medical vehicle, and then there will be a recurring monthly expense of $10,000 for medical supplies. Additionally, the staffing will cost $10,000 a month to have 2 full-time salaried employees working on the project. Because there's already a lot of good work being done by brick-and-mortar treatment facilities such as Total Healthcare and Reach Health Services, we will look to supplement their work through the use of a mobile van by partnering with both of these organizations. That way, we will be able to work collaboratively to reach more individuals in need to help improve outcomes. One of the key risks to this project is if the key stakeholders do not buy into this approach. So part of this approach involves admitting that there's a problem, which can be painful and hard. Additionally, treating those with OUD with medication may spark a little bit of a backlash from some community members or local organizations. So making sure that there's buy-in from all of these groups and explaining the benefits of this program will be key to its long-term success. Throughout the wire, it is clear how those with OUD are negatively impacted by their addiction. And to see the situations in the beginning of the show where Bubbles and Johnny would risk everything to be able to get their next fix speaks to the need for a outreach that could reach individuals in need when they need it most. With the right treatment and support, there are opportunities for those with OUD to overcome this addiction and to live a brighter, better future. This project will bring this positive influence to the 21217 area code and will help the stakeholders in this area as well as those who specifically have OUD.